Hey, good afternoon, everyone. Thank you so much for joining us today for our Special Olympics Kansas monthly health webinar. Today is a very special day because it is not necessarily associated with our virtual health and fitness, although it is a separate program through our monthly health webinars where we have athletes, parents, family members, all types of disciplines who are joining us today to learn about improving their health and improving the health of those who are around them. So today we are so grateful to be welcoming Elaine Johannes back from the K-State University Research and Extension. She was one of our speakers of our Family Health Forum back in November, and we think that Elaine is so amazing, we had to invite her back. So thank you so much for joining us again. Your presentations are always so engaging, and I love them a lot. So with that being said, Miss Becca, can you introduce Elaine to our people on Facebook and Seth, Abby, and Rebecca Shepard? Go ahead.
Hi, my name is Becca Henderson. I'm with Speak of Shawnee / Speak of Stars. I'd like to thank United Healthcare for this awesome sponsorship.
Thank you, Becca. Can you introduce Elaine for us with the bio?
Oh, yes.
Perfect.
Elaine Johannes Johansson is the Kansas Health Foundation
Distinguished
professor in community health and state extension specialist in family and youth development at Kansas State University. Dr. Johansson has degrees from Kansas State University in psychology, adult and community
counseling
and lifespan human development. Elaine is a member of the exclusive committee for the Kansas Maternal and Child Health Council for the Bureau of Family Health. Kansas Department of Health and Environment serves on the state public health system group and is a governor's appointee to the Kansas Step of the Corrections Kansas Advisory Group of Juvenile Justice.
Perfect. Nice job, Becca. Nice job. That was absolutely perfect.
Thank you.
Thank you so much, Becca. And let's welcome Elaine. We'll pass it over to you.
Thank you. Thank you, Becca, Jesse, the athletes, the families who've joined today. It's an honor to be with you again. My word, were we all together in November? And here we have a new year. I think all of the athletes and their families are aware that we're still suffering and dealing with the pandemic. But there's some really good news out there related to vaccination. And hopefully that is something that you and your families are all thinking about. And actually, when we think about vaccination, when we think about our own health, when we plan for our health, that's actually what the topic of my remarks are today. When we know we're changing, when we transition from being a child to an adult, sometimes our own health care needs to change too. And we transition to different kinds of healthcare. So I am wanting to share some ideas and I want to hear from you as time allows. The picture on my screen, my PowerPoint right now is representative of a change. I think all of you who logged on back in November knew that I started that PowerPoint off with a picture of the Konza Prairie, which is directly east of me. And that picture was representing fall, the changes in color. And so today I have another picture of the Konza Prairie. This one has snow on it though. And some of us in the state probably had snow maybe a week ago in the winter. I know today here in Manhattan, it is warm And so we even have changes in our own state and changes wherever we live. So I wanted to share that with you, and also thank you for joining today. One of the things that Becca read, which I think is somewhat important as we talk about this, Becca, I appreciate you letting people know that I am a member of the Maternal and Child Health Council for the state. And that's a group of people from all different agencies, departments, programs, towns that have been selected to help the Department of Health and Environment in the Bureau of Family Health make some wise decisions about how we invest our time, our talents, and the funding that we have. So as I've been serving on that council for quite a few years now, I have learned about what the transitions between childhood care and adult care mean. They're great. The great transition between going to see our pediatrician when we were a child. I remember in Salina when I would go, and I do remember clear back then, if I had to get a vaccination, be immunized, get a well check. I remember that in a fond way because my doctor at the time had a special drawer of toys. And if it all went well, I was able to pick a toy and take it home. But to transition from a pediatrician, from being a child now as an adult, and as I move from being a child to a teenager to a young adult, I had to transition my own thinking and transition my own goal. When I went to a doctor, when I became an adult, I had to communicate my own health concerns. I had to ask questions in a particular way so I understood what the answers were, and I didn't expect a toy at the end. I don't know if the parents on the program today or some of the other adults here or the athletes remember when you had to transition from being a child to now you are needing to advocate for yourself. And the transition can be somewhat difficult. And that's what we're going to be talking about today. The transition between child care and adult. So back to my membership as a member of the Maternal and Child Health Council for the state, we became aware that the federal government, through the Department of Health and Human Services, had some programs called Get Transition. And the Get Transition effort was to help people learn how to advocate for themselves and how to move from being in pediatric care to now becoming part of adult. So that's what we're going to be talking about today. And many of my remarks are from being a member of the Health Council and also bringing to you today the need to understand the transitions that happen between child health care, meaning oriented towards us as children, usually under the age of 18. And then as we transition to adult care and maybe physicians who take care of our adult health concerns. And so we're talking about transitions, which require us to transition from one condition to the next. And I wanted to show a picture to everybody, and I hope you can see this. Monarch butterflies go through a lot of transition. And this is a picture. I hope you can see this. There's a glare though of the chrysalis phase of what the monarch butterfly has. And this was actually taken outside in my backyard in July. And then we were tracking to see that from the chrysalis, the monarch then became the caterpillar. And actually, I got that wrong. The caterpillar started first, then the chrysalis, and then the monarch itself. And monarch butterflies are something that maybe we could all try to take care of, replenish. They need environments and food and water actually and safety areas to thrive. And our monarch butterfly population is diminishing, going down. So the more we can kind of pay attention to their lifespan from being a little one to kind of going through a change and then becoming an adult, I think the more we can help any person or creature to transition from childhood to adulthood, the better it is. So let's see then. There we go. Okay. And I'm realizing this screen may look very small. So I can go ahead and make it bigger if you'd like. Let's see if we could do that then. However, this is one of the handouts that we have worked on with the council and that I'll send to Jesse so he can share it with you after the seminar today. But when we talk about getting ready, are we ready to move from becoming just a patient of our doctors to actually being a participant, a partner in our own healthcare? And this handout reminds us that first off at the top there, we need to get ready. And getting ready means that we have to know what our healthcare needs are. There we go, maybe a little bit bigger. Sorry. We need to know what our healthcare needs are. We need to know what our medications are. And we need to know what our personal history is related to our conditions, our allergies, the surgeries we've had, the treatments that we've had. And so knowing that sometimes means that we have to write it down. Sometimes we have to have a file, a lockbox, a virtual folder where we keep track of our health. The next thing we need to know is, are there conditions or things that we don't know enough about? So we find out the names of things, the names of our prescription. We find out who provides our health care. And we ask questions maybe through a reliable source like the adults in our lives, through other athletes that we trust, people that can provide information that's credible. And as you might guess, if we only use information from one source on the internet, maybe it's not reliable. So reading, having 3 different resources, WebMD is a reliable source on the internet, and maybe one of the adults who's maybe got a few more years ahead of us. But down here, and I want to go through steps 1 through 6. I'd like for us to go through those and then have a discussion about, are we ready? Are we really familiar with our own healthcare, and are we ready to move into being a partner with our physicians? So how do we get ready? Well, number 1, we need to listen and learn from the healthcare professionals that serve us now. They do know things, they are experts, even though we may be able to have looked at our diagnosis or looked at what treatment we have on reputable internet websites like WebMD. But we also need to listen to the healthcare providers. And in listening, we're educating ourselves about their concerns and about how we participate in our own healthcare. I had mentioned earlier that as a child growing up in Salina, I remember going to see my pediatrician. My mother would take me, and I remember that she was the one asking questions. She was the one writing things down, and I just kind of sat there and behaved. But as an adult now, we are the ones asking the questions, writing the things down, and then taking action. So that requires that we listen first, step 1. Step 2 is, again, taking the opportunity to ask a question that we really want the answer to. And I realized that when we go to see a doctor, a nurse, a healthcare official, it may be rather scary and intimidating. And that's the reason why I always write my questions down before I go. Um, some of you may actually be getting visits through telehealth now, through the internet, through your own phone. As athletes, I imagine you use a lot of web-based resources to understand what your sport is, to understand how to improve, to actually understand what kind of exercise and practice you need to do to improve. Well, we're using the internet now for healthcare. And maybe some of you have already had checkups to see your doctor, to see your nurse, to see your healthcare official or expert through your cell phone. And I still, when I have to do that, I still write down my questions before I log on and before I know I'm going to interact with my physician. That's number 2. Number 3, tough one, no, important, is speaking up, respectfully speaking up. Sometimes when we have questions and a doctor, a nurse, a provider answers and it's still confusing, sometimes we may not speak up. We may not ask a follow-up, or we may not share what's really happening, what's really the way we feel about our condition, about what's wrong, or what we're worried about. And speaking up takes practice, a give and take, listening to what the healthcare official, healthcare provider tells us, and it's a partnership. That is one of the things that is different when we're kids. A pediatrician is prepared to give us good health care as a child, but as an adult, they expect us to be a partner in our own health. So that's number 3. Number 4, we got to take action, guys. We have to follow up, follow through. As athletes, you know, you have to follow through on your routines to practice, to exercise, to gain strength, to gain speed, to gain agility. So we have to follow through with reasonable requests, with reasonable changes in how our healthcare provider is working with us. And even if it's online through cell phone, we have to communicate that their recommendation, if it's hard to do or uncomfortable, they may not know that. For example, if they recommend a change in our diet to reduce salt, to increase more fruits and vegetables, and they give us a whole laundry list of nutritional supplements or other kinds of things. And if we know we can't afford them, or if we know we live in a part of the state that doesn't have access to some of that good advice, we can't follow through, then we go back to speaking and saying and being an advocate for ourselves. Because again, in adult care, we transition into a partnership. Number 5 is involving the adults in our lives. Could be our parents, could be our older brother or sister. It could be a care provider that we really trust. It could be people in the Special Olympics office that looks out for us. It's a transition not only for ourselves, but when we transition from child health to adult health, they transition with us. And sometimes it's hard for the parents, the adults in our lives who are older than we are, to see us actually not maybe need them as much. But we'll still need our parents. We'll still need all the adults in our lives. We'll still need our doctors and our nurses. But the relationship is different. And then number 6, celebrate. Celebrate when we're ready to take charge of our own health. Celebrate when we've accomplished a partnership, and celebrate, yes, when we are adults. Like that butterfly, when we're ready to launch. So I'm going to ask you to share, if you're comfortable, your transition stories, your transition questions, and maybe experiences. When we transition from one side of the developmental bridge, meaning being a child, going to see the pediatrician, wanting to get the toy after the checkup. We transition, we rock over that bridge, and we transition to adult care, to being a partner in our own health care. It can be difficult and it can be scary. So I wonder if anyone on the program today would like to share how you've been able to succeed. Rebecca, I see your hand. Yay. Please feel free.
I mean, I don't know if I'm going to be talking exactly about what you're talking about. I'm in the middle of peeling potatoes for dinner. But just like the transitioning from a child to an adult, I mean, it was a little hard. I mean, I have ADHD and several other diagnoses, and it's hard sometimes because I still feel like I should receive something like a sucker or something. But growing up, it's been hard. It's just really been hard because I feel like if it's not a sucker, it's a sticker, it's something. And I just feel like that I know with that reward that I had a good appointment, that I don't have to go back to say, oh, I did something wrong, I need to fix it. Just knowing that everything went good.
Yeah. Rebecca, thank you. First off, thank you for able to peel the potatoes for dinner and also join us. So thank you.
You're welcome.
Boy, talk about skill. I don't know if I could do it. But the other thing I want to thank you for is something that all of us need to take time with to reward ourselves. You are correct. When we're children and we have a good checkup, we've done well. Like I said, I was looking forward to that, picking that toy out of the drawer when I was a child. But even as adults, we need to reward ourselves with maybe a text to a best friend, a picture of something we saw in the community that made us smile and we send to, someone that we care about. Or, it's not unheard of that you would go and maybe go get your own sucker and say, you get to pick out the flavor you like.
Right.
Going to a doctor, for me is still kind of scary. I mean, you're going into a clinic, you're seeing people behind closed doors, and you may not really know what the diagnosis or what the treatment or what's going to be talked about. So
Right.
yeah, we need to reward ourselves.
Well, and I start my physical therapy tomorrow, and I don't even know what to expect. I mean, it's for my knee, and I'm just like, holy cow, but it's somebody that my mom knows. So I'm pretty excited about that.
Okay. Oh, and there you go again, saying just what we want to do is be excited about being a partner in our healthcare and improving whatever we need to improve on.
Absolutely.
Anyone
Seth.
else would like to share your experiences with the transition into adult healthcare?
Seth, do you want to share before you run off to dinner real quick or Bible study?
What do you mean? Share as in?
What has there been any challenges as you've transitioned from your youth into your adulthood in healthcare in any way?
Like my adulthood, like joining, like since I left youth group, I joined the Bible study group, and then the college group. I was part of the college group, but I have transitioned from the college group to the adult group that we have at church, and so now I'm part of the adult group, and so tonight is my first night being with the group. So
Okay.
I actually have to be on the Bible study at 6, so another 2 hours I have to go shower and then I have to be on the call. So, but I need to go eat dinner as well, and so I was telling Jesse I need to dip out to go eat dinner, and then I have to be on a call. So.
Well, Seth, thank you. Thank you for joining us. A busy schedule tonight. Your day is not done, is it?
No, it's not. So, but so I'm sorry that I have to dip out. I would
No.
love to stay, but I have dinner and then I have to be on Bible study. So
That's okay. I may ask the people who are remaining, um, as you have transitioned to adult care and you recognize that that's a change for you, and that may have been a very simple change, or it may have been kind of challenging, especially if you could not find a provider, a doctor, a nurse, a clinician who met your needs. But how did your parents do? Do you remember? Were they able to move along with you, transition? Did they help you move into those adult roles now? Does
So
anyone
with me,
remember? Yeah.
Becca, I've had a bit of a rocky life, but the family that I live with is not my real biological family. It's my Good Life Innovations family, and they've helped me a lot to transition a lot from, because I mean, the lady, she was my case manager for 5 years, and from her knowing me to being my case manager for 5 years, and transitioning from her to being case manager to being my professional teacher, is a big change for me. She really points out to me that, Becca, you are an adult. You need to do this or you need to do that, and not worry about what you did when you were little or younger, because that's what's in the past. This is the future and the presence. And it's just a lot that, I don't know, it's just a lot.
Mhm. And it takes some thought, doesn't it? It takes
Oh,
some awareness of the way it feels and how
yes.
uncomfortable it can be. Similar to this bridge that we have on the screen right now, we can be comfortable on one side as a child,
Mm-hmm.
but to get across, we're going to have to take a risk. But notice that the picture of this bridge has the rails. So
Right.
there's some ways we can prepare. There's some ways we can be safe. And maybe there are some people that would walk across the bridge with us, not
Mm-hmm.
stopping us,
Right.
because we all need to grow into adulthood, but to get to the other side. And so I like what we're discussing, because takes time and it can be very uncomfortable, but
Yes.
it's necessary, because we all grow up and we do become responsible for some of our own healthcare and some of our own thinking and
Mm-hmm.
asking the right questions in a respectful way. Um, Abby, I don't know if you have anything that you'd like to share about the transition and who has helped you do that.
Um, Usually, leaving my childhood was hard for me. Is I had like fun things to do in my life. It was kind of hard for me. Oh, sorry, it's confusing for me to explain it. So my dad just helped me because my birth mom left me and my brother. So, and that was like hard to not have like a mom role model half of my life, but now I do. And it's just, it wasn't, change is what got me really big. I don't like things changed. And my dad and my mom helped me on the way to adapt to it. And
Yeah. We prefer routine, right? We
yeah,
prefer consistency. But dear friends, this past year and so far this year has handed us a lot of opportunity for change.
yeah, because I have someone very close to my heart's in the hospital right now.
Okay. That's a change too. It's
I'd like just to say that I've lived in so many different group homes and residential places before I was able to come live in this home with this family. And it was a real struggle. I mean, I could not be settled in one place for like a day. And I was just so unhappy. It was crazy. So when I finally found out that I was going to live with this family, I was very excited. I get to, I'm learning how to drive, for instance.
Oh my gosh.
And it's been a struggle, and it still is. Me and my driver instructor actually drove myself to my work today when he picked me up, and then drove home, and then we did it again a couple times, and then we went on some country roads where it was just two-way traffic, one going one way, one going the other way. And it, like, I was just telling myself, you know, just stay in my lane, do what I have to do to stay in my lane, and just do what I have to do.
Yeah, do what you have to do. And that's being an adult. So to kind of, thank you for sharing that, Rebecca, by the way.
Welcome.
So to kind of wrap up, I want to remind us of the 6 things we need to keep in mind when we move towards adult healthcare and when we're really in a partnership with our physicians. So number 1, listen and learn from them, from reputable sources. Again, WebMD is one if you use the internet. Educate ourselves. Number 2, take opportunities to ask. Take the opportunity. If a doctor, a nurse, a clinician asks us, do we have any questions? Well, yeah, you've written them down before you go, either go to the clinic or log on with them through telehealth. Number 3, respectfully speak up. If the response, if the question's answer is not clear, then let's speak up. That's what adults do with respect. We are a partner in our healthcare, and we have to advocate for ourselves.
See,
Yes.
for my doctor, we have like an app that we can send message in to our doctor, but that's also, and we can also communicate. It also keeps track of like the medicines and our blood test or something like that. So like they can ask what you've been on, and they can just go look in there and they say, oh, she's been on this for sinus infection, or just like for sore throat and stuff, something like that. So it has like medical database where it keeps all our medicines, our which doctors we get that we went to go see, the vaccinations we had through our lives. So it's kind of like that, and it is just really confusing.
Abby, yes, I understand. And, you know, for the years that I have that are more than yours, I'm sure there's a huge file folder somewhere with all of my stuff. And I do try to track it myself though. And maybe you could get a journal and start writing it down too, because it's important to know about our own lives and our own history. So that actually brings us to number 4, honestly, which was take action, follow through. If the doctor, the clinician prescribes something, more exercise for me, follow through. And I'll put that in my journal, or maybe you could too. They remind you to do that. Number 5, again, we've talked a little bit about, we don't transition alone. Typically, we have parents or loved ones who want to support us to get us to the other side of the bridge. We don't transition without maybe some colleagues in the Special Olympics, some people we trust because they care about us. And then finally, number 6, don't forget to celebrate. When I heard Rebecca say, you know, celebrate by rewarding yourself. Yes. Yeah. Because, you know, we need to take care of ourselves too. So let me leave you with that. I don't know if you were with us in November, but I ended with stop. Taking
Yeah.
care of ourselves. This was one easy way that we could handle stress or maybe anxiety or maybe feeling
Okay.
out of sorts for that day or that time. So as we move on through the evening or to the evening to dinner time or whatever activities you have planned, I would encourage you, all of us, in these times of change and maybe some challenge, stop, take a breath, and breathe deeply. I would encourage us to observe what that breath means to us, to calming down, centering ourselves. And then we can proceed. It doesn't take a lot of time, but I do think if we can stop, watch, and learn and proceed, we will be good to ourselves. We'll be good advocates in our own healthcare. And wouldn't it just be easier to get through the day?
Yes, very much.
It would be. So,
My days are just like really crazy. I mean, I work 9:30 to 1:30, only 4 hours a day, but I work at a school for the Hayesville School District in the food service department, and there's always something to do. But like today, we were super slow, so all of us were wrapping sporks with napkins, and it was just insane. Like I was like, can I do something else?
and oh my goodness, you are part of this whole community. I think we would all agree. Can we just do something else? Well, I so much appreciate joining you all this evening. What a perfect way to end a busy day with the Special Olympics, with the athletes, the families, and all the professionals that support the good work y'all do. So keep in touch. You have my email there. Jesse, I will send you the PowerPoint, and in that middle one, you could blow that handout up. And actually, it has those 6 steps
Yeah.
for the transition from child health care to adult. And if we can all accomplish that, we'll be well underway.
Elaine,
Yes.
I'm gonna, if it's okay with you, I'm gonna forward your PowerPoint after Jesse sends it to me because I just feel like other people need to know this message too.
Okay. Do so. It's all for you guys. Beck introduced me as part of Extension, and the K-State Extension system is part of the whole state. And that's the reason why we're here, to provide information and to be part of your good work. So,
Awesome. Thank you so much.
thank you. Jesse, I want to thank you. And I don't know if there's any closing remarks before everybody gets on.
That was awesome. Thank you so much for doing this, Elaine, and thank you, Rebecca, and thank you, Abby, for joining us tonight. I think that we had low numbers tonight, but I think the conversation was very high quality. So I'm so thankful that you guys were here with us tonight. And then Elaine, what I'll do is I will post the videos on Facebook. I'm gonna snip out our little interruption and piece the 2 videos together. And then with the picture that you sent us, I'll also send those out via email and then post those on Facebook for our athletes to see as well. So thank you guys so much. And I think we're go ahead and wrap up tonight with that.
Y'all be well. Now take care, okay?
Absolutely.
Have a
Thank
good
you.
day.
Thank
Bye.
you. We'll see you guys
Bye,
later.
Jesse. We'll be in
Hey,
touch.
Jesse,
Yeah.
we are still meeting at, are we meeting